Good morning, everyone. Dr. Alan McCord continuing our regular series of Ask Dr. McCord, which is video presentations about questions that you all might be having about your health and about natural healing methods, chiropractic care, those kinds of things. And today we're doing a very unique Ask Dr. McCord because I have a special friend and a patient practice member of ours joining us here today, Robert Salen, who I've known for decades and has been a great friend of myself and my family's and been utilizing chiropractic care over the years. And we want to ask Robert, he's got some incredible information that he would like to impart regarding his story about how some of the things that we've encouraged and recommended here for him to do. So Robert, tell us just briefly a little bit about yourself and where you're from and how you became a patient here. And let's talk a little bit about some of the issues that you've had as well.
Well, I was born here in Washington. I've lived here my whole life. I'm 57. I've dealt with pain all my whole life. Chronic pain, getting out of bed, you can't move, you're sore. And I used to take like a steroid, like a prescription steroid. And I just know it works. Hey, everything's good with drugs, but they're not good for your body. So I just found that taking the non-narcotic stuff like the inflammation helps, like glucosamine and fish oils, they make a huge difference in helping your body overcome the inflammation and pain. And there's medicines, I take all kinds of medicines for pain and for that. I just used to take like anti-inflammatories like prescription drugs, and I take like aspirin or ibuprofen, and those are all bad for you. Long term, they're bad for you. So I've just been taking vitamins that make a difference in my body, and then chiropractic, of course. It's the biggest thing is the overall health of your body is staying away from drugs and drink water. Water is the way to go. Drink lots of water because it's the answer.
Yeah, hydration is really important. Our bodies are 70% water, 75% water. Most of us are dehydrated. They say about 80 to 90% of us are dehydrated. And that in itself can magnify the pain. So when people are in a pain state because of overuse or traumas, those kinds of things that they've suffered over the years, then when the body releases the pain hormones, if you're dehydrated, then that pain gets magnified. So properly hydrating your body on a regular basis and bringing your hydration levels up can make a big difference. Plus the fact here, you've been using our medical grade water, Kangen water, which is medical grade water that they use over in Japan. It's in 250 of the top hospitals and clinics over there. 6,500 medical doctors recommend it for certain health conditions. And we do find a significant improvement in pain levels when people go on that water. And you found that to be true as well, right?
So it's just drugs work and they're great, but if you take them long term, it's just going to kill your body and your liver and your kidneys. And I mean, if that's what you want to do, if you want to kill your body, then go for it. But I don't want to do that. I want to do it healthy. I want to live. I don't want to be controlled by drugs and have to keep going to the doctor and get a prescription. If you can just go to the store and buy vitamins and buy minerals at the store, why would you not do that?
Plus, yeah, like you said, it's better for your health and you're not getting the adverse effects, right?
Fish oils, I mean, glucosamine, it's all good for your body and it's healthy.
Yeah, one of the things that we have found that helps with inflammation, which is the cause of a lot of chronic pain, is because of deficiencies in the diet. And you're mentioning fish oil, and every cell, our bodies are made of 70 trillion cells, and every cell in your body is surrounded by what they call a bilipid membrane. Lipid is fat. So there are fats that we need in our diet. 150, 200 years ago, we were hunter-gatherers, and we didn't eat corn or grain-fed meats, and we didn't eat a lot of grain, and which has in it omega-6s. And so now today, the standard American diet has an imbalance of omega-6s to omega-3s, which is another type of fat. You're mentioning fish oil, and fish oil has a high amount of omega-3s, which are known as essential fatty acids in them. But our standard American diet has an imbalance of like 30 of omega-6s to 1 omega-3s. And when we have that imbalance in our diet, that sets us up as well for a chronic pain situation. And by supplementing with omega-3s, like you're saying, fish oil, or there's other vegetable sources that you can get as well, that the body then utilizes that, balances that ratio, and puts it in a non-inflammatory state. So your body is not as inflamed. And so by you doing that, certainly helping, and also reducing the amount of grains in your diet. So if you're eating a lot of grain-fed meats, even grain-fed chicken will have a high amount of omega-6s in it. So you're eating chicken thinking that your body's really being helped by that, that it's really a good thing to be supplementing with a good omega-3 essential fatty acids from fish oil. Also, you'd mentioned to us earlier when we were talking about this that you've utilized some acupuncture care too, and you found that to be helpful.
That was a huge difference. If there's a way of getting medicine in your body and it's not a drug, then I do it. And acupuncture, chiropractic, decompression therapy, I mean, it's a healthy way of getting rid of pain and not taking drugs. And I think if it's going to help my body and I can feel better, I go for it. I know some people say it costs them money. It's like, it costs money to be sick too. And I mean, it costs money to go to the doctor. It costs money for surgeries, thousands of dollars. And if you could get that healthy way of doing it, going through a chiropractor or something, why would you not? Why would you not do that?
Yeah.
People say, oh, I don't want my back cracked, whatever. That's crazy. But people make excuses.
Yeah, I think when a person actually gets a chance to try and experience the care that we provide here, they find it's not as adverse to their bodies, and that it actually helps them to feel better, and that's why they keep coming back, not because they need to necessarily, but because they want to remain healthy and stay healthy.
You have pain and you keep taking the drugs over and over. So my question is, well, stop doing that. Well, you can't stop doing that. But people go to a chiropractor one time and say, oh, I feel worse, and they stop. It's like, why? Why? Why would you stop?
Well,
you keep taking the drugs.
Usually it's because they don't understand it, which is a good point. But you have certainly applied a lot of these natural things in your life, Robert, that have been beneficial to your health. So you would count your experience here at Kenny's Chiropractic and the care we're providing a valuable part of you carrying on with your life and remaining healthy and as best you can from a natural
And it's not just the procedure, it's the person doing it.
Right.
And that's a plug for Dr. McCord.
Well, that's true. I mean, there are different chiropractors, and it makes a difference. Yeah, training and all of that can make a difference. I appreciate that, Robert.
Okay.
Because you've seen other chiropractors. Yeah, so you can speak to that as well. And I appreciate certainly the compliment. Do you have any final thoughts as we close today?
I just, if you're out there and you're dealing with pain and you're taking drugs and you're going to the store and taking ibuprofen and stuff like that, it's bad for your body. And I mean, I know I'm just one person, and you're looking at me on a video screen probably, and you're thinking, well, I'm a paid actor. I'm not. I'm just doing it because it helps me. Stop taking the drugs and, do it the smart way. Do it the healthy way.
Thank you, Robert. So, yeah, we have a lot of information for our practice members. Certainly, we'd like you to go to our website, which is kenteastchiro.com. And if you'd like this information that we're sharing and you want to hear more about questions that have come up in the past that we've addressed, you can subscribe to our YouTube channel at Ask Dr. McCord. Thanks for being with us. And Robert, I want to thank you for committing yourself to trying as much of a way naturally to get well and to stay well. And that's a compliment to you that you could go the easy way and do the quick fix of taking the drugs and medication, but long term it could be detrimental. And I want to thank you for that attitude as well. And we love you being a part of what we're doing here. And thank you for sharing.